Lidcure, a novel microexfoliator to treat blepharitis. Dr. Nikhil Balakrishnan will speak on this paper.
Good morning, everyone, respected judges on the dais and the audience. Today, I'm going to present my novel study, which is called as Lidcure. It's a novel microexfoliator to treat blepharitis. I have no financial interest in this study. So as we all know, blepharitis has symptoms like excessive tearing, redness, flaky skin around the eyes, crusty debris along the lashes, and blocked meibomian glands. Almost 35% of patients today have some of these eyelid symptoms. Anterior blepharitis is when you see these scales on the margins of the eyelashes, and posterior blepharitis is in the form of meibomian gland disease. Now, as we know, meibomian gland dysfunction can be treated with warm compresses, with lubricant and anti-inflammatory drops, oral supplements, IRPL therapies, or even LipiFlow therapy. But conventional anterior blepharitis is treated only to treat antibiotics to treat the infections, steroids to treat the inflammation, and other medications to treat the underlying causes. So our aim is to find if there is a new kind of microexfoliator that helps to exfoliate the eyelid margins and helps in a way to treat blepharitis. Now, it's a prospective interventional study. There were 50 eyes who underwent the Lidcure along with conventional treatment and 50 only conventional treatment. These were the inclusion criteria and exclusion criteria in my study. Now, we did for all the patients a tear breakup time, a Schirmer score, an OSDI score, a tear film analysis in which we checked the mean OSI. We did a meibography, a lid margin abnormalities to check for telangiectasia, and I've graded it out here. And also, we also checked for the crusting on the crusting of the eyelashes. Now, all tests were carried out prior to and 4 weeks after the procedure. Now, what was done during the procedure? We used numbing drops. We cleaned the eyelash with a cotton pad, and then we attached a Q-tip to the device that we have innovated. And then we used the procedure. So basically, you use the device and you clean the eyelid. Where the eyelashes, the roots of the eyelashes are, for 5 to 7 minutes. And following that, we again used lid wipes and an antibiotic drop was instilled. Now, this was done twice. 2 sittings were done on 1 month apart. And what were the results like? So we saw that with this, there was a significant change in the TBUT scores before and after. But whereas in a conventional treatment, there was no significant change. The Schirmer score showed a significant change both in conventional treatment and using the novel Lidcure device. The mean OSI score showed a drastic decrease using the Lidcure device, but the conventional did not show any significant changes. The OSDI scores, the patient themselves reported that they were much more comfortable after using the Lidcure device as compared to conventional, where there was no significant change. In case of meibography, which is basically posterior blepharitis, in these cases, there was no significant change using either the Lidcure device or in a conventional treatment. Here we see that the telangiectasia also had severely reduced using our device, but there was no significant change in the conventional treatment. Same with the eyelash crusting. Here we can see a marked drop in the crusting of on the eyelashes using the Lidcure device, whereas the conventional treatment did not show any significant change again. So to conclude, this Lidcure, which is a microexfoliator, helps to increase the TBUT, helps to increase the Schirmer score, causes no change in the meibomian gland dropouts, causes a decrease in the mean OSI, causes a decrease in the OSDI score, it reduces telangiectasia, and also it reduces the eyelash scruff. So this Lidcure device helps to efficaciously treat anterior blepharitis. This study adds that it helps to remove the accumulated bacterial biofilm from the lid margin and remove the scruff from the lid margin too, and helps improve the ocular surface overall. Now, how do we translate science to the clinics? We can use the Lidcure microexfoliator not only for patients to treat anterior blepharitis, but prior to cataract and refractive surgeries too, where we can improve the ocular surface health before the patient undergoes these procedures. Thank you.
Very nice.
Thank you. So I have also, if you have permission, I can even show you I've got the version of the device also, if time permits.
No.
That's okay.
Thank
Doctor,
you.
have you included the Demodex, looking for Demodex in these cases?
Yes, ma'am. So we, in our inclusion criteria, we've even included patients of those. In those cases, though, what happens is definitely helps, but you have to use special wipes which have tea tree oil, which help to loosen out the Demodex in those cases. So this will remove the bacterial biofilm, that means the scruff which is there on that. But sometimes these Demodex are so firmly adhered to the eyelashes that you need those specific wipes which have tea tree oil, which help to loosen out the Demodex in those cases. But this definitely helps in those cases also once you've used the wipes to reduce the Demodex in the.
Thank you.
Thank you.
You're welcome.